therapy. I'm Dr. Catherine Price. I'm a physical therapist, and today I'm going to share with you how to correct a right anterior innominate dysfunction in combination with correcting a left posterior innominate dysfunction. So what is an innominate dysfunction and why are we going to correct this? So the anterior innominate dysfunction, so an innominate is going to be one side of the pelvis made up of three bones: the ilium, ischium, and the pubic bone. And when one of them is out of position or differently displaced compared to the other, then we call that a dysfunction. And there's different types. There's up slips, down slips, in flares, out flares, anterior and posterior. And the majority of the population has a right anterior innominate dysfunction when the innominate dysfunction is present. And why this is the case, there's different thoughts about why this occurs. We have imbalance as far as our organs because they are not symmetrical internally. We have a heavy liver on our right side. Perhaps that is causing some change in the stress in the body that can make us more susceptible to that right anterior innominate dysfunction. And if there is not strength to maintain the pelvic alignment, if you've got ligamentous laxity, then perhaps the body can fall into that pattern based on the structural alignment and the way the body is built. So the majority of folks do have a right anterior innominate dysfunction, left posterior. I'm going to show you how to use muscle energy technique to correct this innominate dysfunction. So the first thing I'm going to do, I'm just going to use a block and a dowel. You actually do not need any tools whatsoever to correct this. So why we're going to use the block is I'm going to start, and when a therapist usually is going to begin to check you for innominate dysfunctions, you're going to bridge up and come back down. And I'm going to squeeze the block because my adductors are attached to the pubic bone, and this is just going to help level the pelvis. So I'm going to squeeze the block, lift my bottom, come right back down, squeeze, and then lift, come back down. And I will do this a few times. It will not take much just to activate those muscles. After I've done that, I'm going to grab my dowel. Now I'm going to use the glutes, the buttocks, to take that anterior innominate dysfunction and correct it, to bring it back. And then I'm going to use the hip flexor on the left side to bring my innominate forward on the left side. So what I'll do is I'll take the dowel, I'm going to lift my right leg, place it behind the thigh, just above the knee, take my other leg, bring it up. I'm going to lift and push into the dowel with my left leg, and I'm going to push down with my right leg, and I'm going to hold for a count of 5. 1, 2, 3, 4, 5. Relax. I'm going to push down with my right, lift up with my left. 1, 2, 3, 4, 5. Relax. I'm going to push down with my right, lift up with my left. 1, 2, 3, 4, 5. Relax. Pressing again. Hold. 2, 3, 4, 5. Relax. And I'll do that for up to 10 repetitions. You can do as much as you want to. The idea is to look to see if the pelvis has aligned. And if the pelvis is aligned, then if you're having any low back or pelvic pain, this can help with that. So that's the rationale for repositioning the pelvis. Now, if you don't have anything whatsoever, you can squeeze your knees together to activate the adductors, leveling the pelvis. You can squeeze, lifting your bottom, so you're just preparing the pelvis. And then I can take my right leg, cross it over my left, and I'm going to lift up with my left leg as I push down with my right leg and hold for a count of 5 here. So I can do that if I do not have any of those tools to use. And that is how you can self-correct an anterior innominate dysfunction. And again, you can use this if you've got low back, pelvic pain, that it could be in combination with that stress from having that misaligned pelvis. So I hope this is of help, and have a blessed day. Thank you.